my name's Marina. I'm going to be your RN today, and today we're going to be doing a physical assessment. We're going to just be looking and listening to all your body systems. It's going to be a lengthy process. Do you need to empty out your bladder first?
Sure.
Okay. So looking at the patient's gait, it is even, balanced, and unwavering. Okay, on your way back, can you put your feet heel to toe for me? Okay, perfect. You can sit down. Okay, so while the patient is sitting here, her posture is erect, she is well groomed, she has clear speech, her makeup is appropriate for the situation. Can you tell me your name and date of birth?
Taylor Gunn, 6/27/99.
Okay, and where are you?
My house.
And what year is it?
2021.
Okay, so a patient is alert and oriented ×3 to person, time, and place. And if you were driving down the road and seeing blue lights behind you, what would you do?
Pull over.
Okay, so patient has appropriate judgment. First, I'm going to inspect your head. Tell me if you know any tenderness.
No.
Okay, so looking at the patient's head, it is symmetrical with her body. It is normocephalic. The hair is evenly distributed, and I see no masses, lesions, or evidence of infestation. Next, we're going to move on to the eyes. Her eyes is symmetrical with the face. Can you close your eyes for me? So external appearance is free of redness, crust, masses, or lesions. Her eyelashes do curve out. Eyelashes and eyebrows are evenly distributed. So let me get my pen light here. Check your pupils. Your pupils are round, and it looks like they are a size 5 bilaterally. I'm going to shine the pen light in your eyes if you can just look straight forward at me. Okay, so pupils are direct and consensual. Then I'm going to have you look at the pen light and then look at the wall behind me. Okay, so accommodation is intact. Eyes are perla. Next, I'm going to get my ophthalmoscope and check your red reflex. Okay, looking straight forward at me. Sorry, had it backwards. Okay, red reflex is present bilaterally. Okay, and then next we're going to do a Rosenbaum test. I'm going to have you cover one eye for me, and then read the lowest line possible.
D-E-F-P-O-T-E-C.
Okay, and then do the same with the other eye.
D-E-F-P-O-T-E-C.
Okay, so eyes are 20/20 vision bilaterally. Okay, next we're going to move on to the nose. The external appearance of the nose is free of lesions. It's symmetrical with the face, no redness noted. I'm going to have you tilt your head back for me using my pen light again. I'm going to look inside of your nose. So the mucosa is pink and moist, so the septum is midline. See no masses or lesions. Next, I'm going to have you do a smell test for me. So I'm going to have you close your eyes and plug up one nostril. And you tell me what you smell.
Alcohol.
Okay, perfect. And then do the same thing with the other eye. Or other nostril.
Vanilla.
Okay, perfect. So both nerves are intact. Okay, and then I'm going to feel of your sinuses, starting with the frontal sinuses. Any tenderness?
Mm-mm.
Maxillary sinuses, any tenderness?
No.
Okay, so no tenderness noted in the frontal maxillary sinuses. I'm going to move on to your ears. The external structure of your ears are no redness, no masses, no lesions or deformities. Any tenderness?
No.
Okay, so then I'm going to use my otoscope real quick and look on the inside of your ears. So starting with this side, I'll pull it up and back and point the otoscope toward your nose. Looking for the tympanic membrane, which is a pearly gray, and no cerumen noted. The same thing on this side. Okay, perfect. Go up and back again. Tympanic membrane is present, pearly gray, and no cerumen noted. I'm going to do a whisper test as well. So I'm going to have you cover your right ear. I'm going to stand over here and whisper 3 words. And you tell me what you hear.
Banana. Strawberry. Pickle.
Okay, so whisper test passed on the left ear. Same thing over here.
Car. Truck. Four-wheeler.
Okay, so both ears passed the whisper test bilaterally. Next, we're going to move on to the mouth. It is symmetrical with the face. The lips are pink and moist. No crest noted. I'm going to have you smile for me. Teeth are white and straight. I'm going to pin line again. Have you open your mouth. I'm going to look inside. Okay, so mucosa is pink and moist. Tongue is pink and moist. Hard palate, pink and moist. Soft palate, pink and moist. And gums are pink and moist. Can you say ah for me?
Ah.
Uvula moves with voice, and no tonsils are noted. Next, we're going to move on to the neck. Looking at your neck, it is symmetrical with your body. The trachea is midline. I'm going to have you take a sip of water for me while I feel for your thyroid. Okay, thyroid is palpable. Next, I'm going to feel for your carotid arteries. Okay, 2+ amplitude, regular rate and rhythm bilaterally. I'm going to listen for any breweries as well in the carotid arteries with the Belmont stethoscope. Okay, no breweries noted. Next, I'm going to, let's see, listen to your breath sounds anteriorly first. Okay, take a deep breath for me. Okay, lung fields are clear throughout and no adventitious breath sounds noted. I'm going to feel for all your lymph nodes. Okay, so starting with, tell me if there's any tenderness noted with any of your lymph nodes.
Okay.
So preocular, postocular, tonsillar, posterior cervical, deep cervical chain, superficial cervical, submandibular, submental, supraclavicular, infraclavicular. Arms out for me. Central, lateral, subscapular, and pectoral. Any tenderness?
No.
Okay, so no tenderness noted. Next, I'm going to move to your upper extremities. Can you put your arms out for me? Upper extremities are warm, dry, and intact. I'm going to feel for your radial pulses. Radial pulses +2 amplitude bilaterally. Do the same thing with your brachial. Brachial pulses +2 amplitude bilaterally as well. Spread your fingers out for me. Okay. Looking at the nails, it's 160 degrees, no clubbing. I'm going to check your capillary refill. Okay, capillary refill less than 3 seconds and all 10 digits. Can you do this for me? Okay, so fine motor skills are intact. Next, we're going to move on to, can you turn your back towards the camera for me? Make sure it's on the view. Okay, so looking at the AP ratio, it's a 1:2 ratio, and going to percuss all lung fields in the back. So all lung fields are resident. I'm going to listen to all of them as well. If you can just continue to take some deep breaths for me. Okay, so all lung fields are clear all throughout, no adventitious breath sounds. I'm going to do chest configuration. If you take a deep breath for me. Chest configuration is symmetrical. I'm going to check your CVA as well. So I'm going to put on the iliac crest and then thump it with the lower part of my hand. Tell me if you have any tenderness.
No. No.
Okay, so no tenderness noted in the CVA. Next, I'm going to feel for your spine as well. So the paravertebral muscles and spinous processes are intact. Okay, if you can turn around for me. I'm going to listen to your breath or your respirations for 30 seconds. If you don't care if I get your water.
Sorry.
Okay, that's okay. Okay. So here we go. Oh, counting the respirations, not here. Sorry. Okay, so I counted 8 respirations, which would be 16 respirations per minute. Next, I'm going to have you go to the head of the bed for me, if you don't mind.
Let's see.
Let's turn about right there.
I can't see it.
Hmm.
I didn't know you could see me.
Yes. Okay. And then I'm going to come up here. I'm going to feel for your point of maximum impulse, which is in the 5th intercostal space, mid-clavicular line. Okay, there's a +2 amplitude, regular rate, and rhythm. I'm going to start by listening to your heart sounds. Okay, I'm going to start with the 2nd intercostal space, right sternal border, which is your aortic valve. +2 amplitude, regular rate, and rhythm. Next, we're going to move to the 2nd intercostal space, left sternal border, which is the pulmonic valve. +2 amplitude, regular rate, and rhythm. Move down to the 3rd intercostal space, left sternal border, which is the Erb's point. +2 amplitude, regular rate, and rhythm. 4th intercostal space, left sternal border, which is the tricuspid valve. +2 amplitude, regular rate, and rhythm. Then back to the 5th intercostal space, midclavicular line, which is your point of maximum impulse. I'm going to listen to it for a full minute. Okay, 77 beats per minute. Okay, next I'm going to inspect your abdomen if you don't care to pull your shirt up for me. Okay, I'm going to inspect the abdomen first for any thrills, peristalsis, pulsations, lifts, or heaves. None are noted. I'm going to listen to your bowel sounds. The umbilicus is midline as well. So listen to all 4 quadrants. Okay, bowel sounds are normal, active. I'm going to percuss in all 4 quadrants as well. Okay, so bowel sounds are tympanic and resident in all 4 quadrants. And its dullness is noted in the right upper quadrant as well, where your liver is located. Can you take a deep breath in for me? Okay, and back out. Okay, the liver is not palpable. Next, I'm going to listen to any bruise with the bell of my stethoscope in your aorta, your left and right renal arteries, and your femoral arteries. Okay, so no bruise noted in the aorta. No bruise noted in the left and right renal arteries. Checking the femoral. No bruise noted in the femoral arteries as well. Next, I'm going to palpate for any pulsations in the aorta. Okay, so no pulsations noted. I'm going to feel for your femoral arteries. Okay, femoral arteries +2 amplitude, regular rate and rhythm on bilaterally. Next, I'm going to feel for any tenderness. Start with light touch. Any tenderness?
No.
Okay. Deep touch?
No.
No. And then going in at a 90-degree angle for rebound. Any tenderness?
No.
Okay. So no tenderness noted in the abdomen. Next, I'm going to have you sit back up for me. Okay, I'm going to inspect your lower extremities. I'm looking at your lower extremities. They are warm, dry, and intact and appropriate for ethnicity. I'm going to listen to your dorsalis pedis. Okay. Okay, +2 amplitude, regular rate and rhythm. Same thing on this side. +2 amplitude, regular rate and rhythm. Listen to your posterior tibial. Posterior tibial, regular rate and rhythm. Same thing on this side. +2 amplitude, regular rate and rhythm bilaterally. Next, I'm going to look at your toes. Toenails are 160 degrees, no clubbing. I'm going to check capillary refill on all 10 digits. Okay, capillary refill less than 3 seconds in all 10 digits.
You might want to move the camera back a little bit.
Sorry. Thank you. Okay. So next I am going to have you stand up for me. Okay, can you twirl your neck for me? Move it side to side, twist for me. Okay, and then put your arms back. And then bend. Perfect. Twist your wrist. And then wiggle your fingers. And then I'm going to have you push against my hand. Perfect. And then put your arms up. Push. Pull. Same thing. Push down. Pull up. And do like this. Push and pull. Okay, so muscle strength is a 5 out of 5, and full range of motion of the spine, cervical spine, and upper extremities. I'm going to have you bend down as well, dangle your arms. No scoliosis is noted. Okay, so then I'm going to have you put your leg up and out. Same thing with the other one. Perfect, and sit down for me. Okay, and then dangle your knees in and out. And then twist your ankles and wiggle your toes. Okay, perfect. Full range of motion of lower extremities as well. I'm going to feel for your joint. Shrug your shoulders for me. Okay. Feel right here. Okay, no deformities in any of the upper extremity joints. Same thing here. I'm going to feel your hips. Okay, no deformities in the lower extremities as well. Next, we're going to do a sensation test where I'm going to have you close your eyes, but right now I'm going to just show you what each sensation feels like. So then this will be soft. This will be dull. This is hard. Okay, so keep your eyes closed for me. Test it on your face first.
Soft. Dull. Sharp. Sharp. Dull. Soft.
Okay, so full sensation in the upper extremities. Do the same thing with the lower. So keep your eyes closed.
Soft. Soft. Dull. Sharp. Dull. Sharp. Soft.
Okay, so full sensation in the lower as well, or in the upper as well. And then now we're going to move on to lower.
Soft. Soft. Dull. Sharp. Soft. Dull. Sharp. Soft.
Okay, next we're going to use a tuning fork. Okay, so we're going to feel here. Tell me when you can feel the vibration.
Now.
Okay, perfect. And tell me when it stops.
Now.
Okay.
Feel it.
Tell me when it stops.
Now.
Perfect.
Feel it. Stop. Feel it. Stop.
Perfect. Do the same thing on your face.
Stop. Feel it. Stop.
Okay. And then you tell me when you don't hear the ringing anymore in your ears, okay?
No.
Okay. Same thing on this side.
No.
Okay. So air or bone to air conduction ratio of 14-30 seconds. So now gonna move on to cranial nerves. So starting with the olfactory one first, I'm gonna have you close your eyes and I'm gonna put something on your nose. You tell me what you smell.
Vanilla.
Okay, perfect. So olfactory cranial nerve 1 is intact. Moving on to 2, which is the optic nerve. I'm going to put my hands behind your head. You tell me when you see my hands.
Yeah.
Okay.
No.
Okay, perfect. So optic nerve 2 is intact. We're going to move on to 3, 4, and 6, which is oculomotor, trochlear, and abducens. So I'm going to have you follow my pen light without moving your head. Okay, so 6 cardinal gazes are intact. Then I'll have you follow it again without moving. Okay, now nystagmus is present. Then I'm going to have you cover up one eye and then quickly cover up the other one. Okay, gaze did not waver, so cranial nerves 3, 4, and 6, oculomotor, trochlear, and abducens are intact. Next, we're going to move on to trigeminal, which is cranial nerve 5. I am going to fill up your temples and have you clench your teeth. Okay, then move your jaw for me. Okay, so optic nerve 5, trigeminal is intact and popping and crepitus are noted. Next, I'm going to move on to cranial nerve 7, which is facial. I'm going to have you raise your eyebrows for me. Smile. Brown. Pucker your cheeks. So cranial nerve 7, facial is intact. Next, we're going to move on to auditory, which is cranial nerve 8. I'm going to do the wine and river test. So I'm going to place this on the top of your head and you tell me when the ringing stops, okay?
Okay. Yeah.
Okay. Weber test passed. Next, we're going to do the round test. Hang on, give me a second. Okay. Well, I already did a round test, actually. Now I think about it. I think so. That's sensation. I think it's this, is it not? Tell me when the reading stops.
Okay.
Okay? Same thing on this side. So bone to air convection ratio is 14 to 30 seconds. Sorry, I had to do it twice. Okay. So cranial nerve 8, auditory is intact. Next, we're going to move on to cranial nerves 9 and 10, which is glossopharyngeal and glossopharyngeal and vagus. Okay. So I'm going to have you take a sip of water for me and swallow. Okay, patient swallows with ease. Next, I'm going to have you open your mouth and say ah. Okay, uvula moves with voice, and then I'm going to check your gag reflex. Okay, so gag reflex is present. So cranial nerves 9 and 10 are intact. Next, I'm going to check your spinal accessory, which is, I'm going to have you shrug your shoulders. Okay, so cranial nerve 11 is intact. Then we're going to do hypoglossal, where I'm going to have you stick out your tongue, move it side to side. Okay, so cranial nerve 12 is intact. Next, I'm going to do the stereognosis test, where I'm going to put two things in your hand and you tell me what they are.
Okay.
And I'm going to have you close your eyes. Okay. And feel those for me and tell me what you feel.
Right hand is a paperclip and left hand is a rubber band.
Okay, perfect. So stereognosis is intact. And then next one I'm going to do is called, I always say it wrong, hold on. I'll look at my sheet just for a second. Trapezesia. So I'm going to have you close your eyes. I'm going to draw a letter in one hand and a number in the other. And you tell me what they are.
A.
Okay.
2.
Okay, trapezesia is intact. Next, I'm going to do your reflexes. So we're going to do brachial radialis first. Okay. Then relax your arm for me. Going to do brachial. And then do triceps. Perfect. Okay, same thing over here. Brachial radialis. Then relax your arm. Do brachial. And then triceps. Okay, so all reflexes are present in the upper extremities. Next, I'm going to do your plantar. Perfect. Okay, and then I'm going to have you stand on the edge of the, or sit on the edge of the bed on your knees like this for me. Okay, check your Achilles. Okay, perfect, and then check Babinski and plantar. Okay, Babinski and plantar are not present, and Achilles and plantar of the lower extremities are present. Okay, and that concludes my physical assessment. Thank you.